right of a child and the Article 33 of the UNCRC. Need for prevention approach. And this is primarily a very close subject for Vendor as a project and close to me on my work and the approach that we've taken at Vendor. So who we have as panelists here on stage are three very grassroots people who will share in the next 45 minutes about their approach, country specific, about how they deal with children at risk, children who are exposed to drugs and a lifestyle of drugs, and also children who land up in these service centers and have some kind of a alternative to their lifestyle. This more in light of India, where we are struggling to actually come up with something specific to handle with the issue of children and the rights of the children who are exposed to high-risk areas in lifestyle of drugs. So I'll invite Sumnima. She's the Executive Director of the Child Workers in Nepal. So Sumnima, you can come up. As an expert on child protection issues in Nepal, Sumnima is engaged in policy advocacy on child rights and conducts awareness programs and trainings to different sections of society. As such, social workers, health officials, teachers, law enforcing agencies on a regular basis. As a founding member of the CWIN-Nepal, she has been working passionately towards these causes for the past 31 years in various capacities within the CWIN. Sumnima is the national coordinator of Nepal's Alcohol Policy Alliance and is also actively engaged in advocating for the prevention of drug use in children. She's a former board member of the ECPAT International and a founding member of the Alliance Against Trafficking in Women and Children and Women's Network for Peace. She's also associated with the Duke of Edinburgh International Awards in Nepal. So you will hear something that is very grassroots in approach. The second person here, I'll go with all the introductions so they all go on stage and we say one time, is Mr. Fredrik Gustav. He's come all the way from Sweden. He's the Chief Section Social Service Municipality of Malmo, Sweden. As Section Chief of the Social Service, Mr. Fredrik is the first level manager with responsibilities for the unaccompanied immigrant minors coming to and through the municipality of Malmo in Sweden. Previously, he was caseworker where he was involved in the risk assessments that adolescents might suffer from drug addiction and other problems, and was responsible for assuring the adolescent survival and well-being with discretion in regards to placement in institutions. He also was a social worker at INOM, Drug Rehab Center, which focuses on rehabilitation programs for people suffering from drug addiction. He's also the former chairperson of Save the Children in Sweden and holds a master's in social work from the Lund University in Sweden. Welcome. The third person here is Dr. Rajesh Kumar, the Executive Director, Society for Promotion of Youth and the Masses, India. Dr. Rajesh is a member of the Juvenile Justice Committee, Honorable High Court of Delhi. He's the President of the International Society of Substance Use Professionals, that's the ISUP, India chapter, and is a member of the steering group of the International Drug Policy Consortium. Dr. Kumar is also the proud recipient of the National Award of Child Welfare 2015 from the Honorable President of India. Here it's a very big thing. He had received the National Youth Award given by the Prime Minister of India in 1989 for contributions to the field of drug abuse prevention in India. He holds a PhD from the JNU in Delhi. That's the Jawaharlal Nehru University in Delhi. Welcome, sir. So the first in line would be you. You want to go up? Yes, great.
Thank you, Diana, for the introduction. When talking about children, I think all of us actually go weak on our knees. But I think we who work directly with children for several years, we actually stand very tall and proud. We've listened to so many experiences and wonderful ideas around gender and working with youth and prevention, and definitely children and adolescents. I'm so sorry, I can't get it right. So childhood and adolescence is a very, very precious periods of our lives, and it is also when the children get into drug use or are exposed to drug use. But it is not only their behavioral issues that matters. What matters is the adverse social conditions and their family relations and the exclusion that the children also face along with their parents and society. And many children who do drugs are not only facing the immediate consequences of drugs, but also face a huge social stigma and deprivation that comes from their social exclusion. Most of these children are also coerced into commercial sexual exploitation, and many of them also suffer from child mental health issues. Because children cannot be segregated from community or family life, the use by parents and family members also matters a lot, and that also makes a big impact in their present and future. And another big issue for the children also is the challenges in preventing HIV when they start doing drugs and are coerced into commercial sexual exploitation. So in Nepal, Mr. Oja has presented some picture of Nepal, and it's becoming a more prominent problem in Nepal, especially with the urban and urban poor areas. And I work with children from vulnerable communities, and one of the things they tell us is that they use drugs to solve problems. And there's a lot of myth about drugs among children, and the awareness programs that are targeted to children and young people must be, I think, re-evaluated. Every single child, especially children who are more vulnerable to drugs, are who live on the streets, and their experiences have been different. They just start, glue sniffing as debuting with drugs, and then they go ahead with experimenting more hardcore drugs, including intravenous drug use, and they face severe consequences. They face not only stigmatization from people in society, but a lot of abuse and exploitation from law enforcers as well, and also people who live on the streets who are bullies. And in Nepal, almost 75% of drug users are between the age group of 15 to 30. So it's a whole span of youth being drugged, I would say. And of them, 6 to 7% users are girls. And some of the drug factors for children, these, I think Mr. Oja also referred to a research with that in 2002, and the children told us that some of the risk factors are personal, where they're vulnerable to emotional deprivation, low self-esteem, and value attached to the kind of life they survive in. And then it has a lot to do with social factors like social exclusion and stigmatization, and also peer pressure, which matters a lot when you live without any guardianship and survive on your own on the street-like environments. I'm sorry I'm chewing this lozenges because I have cough. And then it also matters, the bigger thing that matters also is availability. Everything is available for children, actually. The drugs, which are supposed to be so-called controlled by the machineries, state machineries, are available to children, and especially who live on the streets. And how they have contacts with drug peddlers, they have contacts with huge people with huge positions in police, and everyone who provide and supply drugs. And then another bigger factor is actually exploitative situation for children. We also run child helplines in Nepal and run shelter homes for social reintegration. We have intensive community-based interventions, and we've also found that many foreign pedophiles who have exploited children have used intoxicants or drugs to exploit children. And in the last 3 years, we've been doing a project called WATCH, and we've been working with the Central Investigation Bureau of Nepal and have been able to convict 137 foreign pedophiles, some of them being very high-profile pedophiles who used to work with International Labour Organization in Nepal as child labor heads, and they're now in jail. And they were found not to only sexually exploiting children, taking their pictures, sharing those sexual abuse images, and intoxicating children. And then children become addicted to following the pedophiles. They lure them with a lot of support, help, education abroad, and also with intoxicants. And then one of the emerging issues for children in Nepal, and I'm sure elsewhere, is the danger from online contents. More and more children are using the internet. Everybody, it's just a fingertip away. With 4G and 5G is coming maybe, internet's available. And in Nepal, the accessibility to the internet is fastly growing, even in the villages where you will not have access to maybe milk or a pharmaceutical or a hospital, but internet reaches there. And more and more children are exposed to online harms, including grooming for harm and sexual exploitation leading to drug use as well. And there have been cases filed by the child helplines we run where children have been sextorted, like use their sexual abuse image pictures, and harmed, and then their pictures were shared, and they were also lured into drug use. And in Nepal, the drugs policy situation is very frail, I would say. The laws that we have are age-old, ancient, I would say. And the latest policy would be from 1995, and they do not have any components on prevention, or they absolutely lack gender perspectives to it. And issues of LGBTI people and children is totally lacking. But we actually have a huge opportunity, because now we have entered into a federal system after a long political struggle in Nepal, and that actually allows us to look into our policies and amend them, and also allows to work very closely with the local governments who are more resourced now, who have a more decision-making power and access to resource, and they also have prerogatives to make their own policies at local levels. So there are 753 local bodies we have started working with, and they just give us immense hope of doing something from the grassroots, which can also be applied at the federal state. But when we do the policy work, we must do some evidence-based advocacy for sure. Research is absolutely lacking. We don't even have proper numbers for number of drug users as you had in India. India being so massive, Nepal being just a dot maybe in front of you, yet we do not have information base. That's a shame, and we really have to work hard towards that. Then the most important article for us who are working in prevention of drug use in the UN Convention on the Rights of the Child, the Article 33 actually gives us a foundation to start working in a right direction from policy to the grassroots. We should make our governments accountable to abide by it, to respond to it, and act appropriately. We all know that The UN Article number 33 actually it gives protection to defend children's right to be free from drugs. And then I was very inspired listening to Mr. Hornberg about the human rights perspectives to the drug problem. And when we are talking about children, we're not talking about a section of society who are weak or anything. In Nepal, at least, they are majority. 41% of children in Nepal belong to the age group of up to 16. So we are talking about majority here. We are not talking about some frail, small minority group. And we must give a human rights perspective to whatever we do with children. We have to treat children with dignity and as if they are citizens of today. And when we talk about human rights, it's not just isolated within the use of drugs and substance use. It has to do so much with adherence to their fundamental human rights. That includes survival, protection, development, and more importantly, education. If they are in education, they may not be exploited in workstations or are trafficked for flesh trade or so many other situations they will be protected from if they had enjoyed their fundamental human rights. And then public health. One of the issues people shy away in Nepal, for example, the political parties, so many agencies, they are also into the business of selling health, no? And when we talk about our constitution, the new constitution of Nepal must be the most progressive and beautiful constitution when it's come to children's protection. In our constitution, in the fundamental section of rights, child rights and their right to education and public health is mentioned. But what we do in reality, what policies we have, they do not absolutely at all reflect to what the Constitution has enshrined. So when public health, I think where public health is negotiated, where children's fundamental rights to education is negotiated, then the issues of substance use and drugs would definitely foster. So the legalization or war on drugs may not respond to the wide range of issues related to the drug problem in children. And whenever we start a discourse on, drug use, people either want to take the side of war on drugs or legalization. And for the children who are majority, for example, in my country, where's the voice for them? Then there are many people who are advocating for decriminalization, maybe legalization of drugs, but when it comes to children, as a child rights organization, we definitely advocate for decriminalization of children because we have seen hundreds and hundreds of children who have been criminalized, who were arrested. Their age bar was increased just to criminalize them. If they arrest a 16-year-old, they will just write in paper that they are 18, and they are put into custody, detention centers with the adults, and are sent to adult rehab centers, and their issues are absolutely not addressed, but they become even more, abused and hardcore drug users when they come in contact with laws. And there were several instances where the police, the drug peddlers have a mafia running, and they actually use children to sell drugs and to bring clients. Also within the prison setups, when children were detained in adult prisons, they were definitely vulnerable, but also vulnerable to be using more hardcore drugs, which is much more available in prison sector than maybe in open areas. Then we must look into the perspectives of children. In Nepal, we are very proud. We have at least 30,000 child clubs around the country. We are a country of 30 million people, and we have 28,000 child clubs that are working very, very closely with local governments, local initiatives like the village municipalities and municipalities. They have clubs in the school, the street children have clubs, the children working in various sectors have their own clubs, and they have a say, and their perspectives should be recognized whenever we are doing policy work. In Nepal now we have also become a member of Drugs Policy Futures. We are aiming to start evidence-based policy advocacy for comprehensive, progressive drug policy in Nepal, where children's issues will be given some importance. And as we lead the national alcohol policy in Nepal, we see a lot of challenges coming our way. We've been working for the law to be enforced into action for last 10 years now. 10 years, a decade, and it's still not there. It's a very, very challenging path, but then we have no other way. And then because we work, because the civil society has access and privilege of working very directly with grassroots and children, then the role of civil society must not be ignored by government or law enforcing agencies or in trainings or in rehabilitation or prevention work. They are catalysts, and they know children very well. They work very directly. They have trust from children and communities, and their role should be promoted. And then, of course, media is there. But I was asking people, what does say no to drugs mean? And then, the children who are falling in the traps of abusive, exploitative situations, they would romance the risk. If it's the end, they want to take that end road. They just do not want to abide by so-called normal values in life. They would romance that risk of going ahead, and I will dip down to the death. I want to take that risk because this life does not mean anything to me. So the right messages from media campaigns must be considered. And now with social media like invading into our lives, we must do something with social media for sure, and the message has to be right. Then the national governments obviously should have progressive laws and should have mechanisms. We do have laws. In Nepal, we have signed 28 international human rights instruments, 28, possibly all of them, but what we have in our laws, we have never been able to implement them because we lack resources, we lack mechanisms. Then obviously, when we work directly with children, prevention is the most viable option, and all of us we know, but when we talk about prevention, it's not only about educating them, having, training programs and rehabilitations and harm reduction. It's also about other underlying factors where children are sexually exploited, groomed online, have mental health issues. So all these comprehensive systems have to be in place even for prevention. Prevention is just not going to schools or communities and educating them. It's about creating a safer space for children so that they stay intact, their dignity is intact, and they're not forced to take this path. We have also started the very first child and adolescent psychiatry in Nepal. That was in 2015, and it took a massive earthquake to start that. In Nepal, we only have a single child psychiatrist, and he's working for us. And in the last few years, we've seen how many? 18,000 cases of child mental health, and we are also starting an inpatient service very soon next year. And lastly, my time is over. Children cannot wait. it's an urgency. It's an urgency to start doing something so that we can prevent children from using drugs, because they are not only our future, they are our present. And only answer is, I think, empowering the children. And the children have proven over the years, over the decades, that they can be their own change agents, and we have to respect them for the voice they have. Thank you so much.
Thank you, Sumnima. Thanks. Next, Fredrik.
Hello. Do you hear me good in the back? Great. First of all, I would like to thank everyone for coming out. I'd like to thank everyone in the room. I'd like to thank the organizations putting this together. World Federation Against Drugs, Fourth Wave Foundation, also the UN with their presence in this. My name is Fredrik. I come from Sweden. I'm going to talk a little bit about what we do there in early risk assessments in families, also called casework. Starting early with early interventions, and I'm part of the social services. So we deal with all social problems, so it's not only drug addiction. But basically what we do is that, first of all, you have to have a social service in place where you have caseworkers that look into families. And what they need is they need to know which families to look into. And that requires its own system in society. It requires people giving reports to the social services, a report of concern that here might be a child that might be suffering. There might be some problems within this family. And I cannot stress enough might, because these reports should come from all government institutions. They should come mainly from the school system. So the teachers in the schools needs to be educated into looking and reporting to social services where they see a problem. And they don't need to do an investigation of their own. They don't need to be 100% sure that there's a problem in the family, but that's not their job. Their job is to see a potential problem and report it to the social services. And in Sweden, they are obligated by law to report when they get a concern for a child. And this is also true for hospitals, rehabilitation centers, and most institutions in our society. And this is the first thing that's needed, because otherwise we don't see them, we don't find these kids. Yeah, the legal obligation to report for me is very, very important. And we talked a lot about stigma earlier, and there has to be a sort of trust where you report, that you're not reporting to the police. You're helping the family to address an issue in their family, and you're sending a report to specialists within social services, and they are going to treat that report and that family with care and with respect. They are not going to come in and blame that family. They're going to come into that family and ask questions and try to help. I wrote here, the same goes when you get this report and you start an investigation in the family. You also, in our system, have a legal right to get any kind of documents that you might require, medical reports, reports from school, and the likes. That might be of value in your investigation in the family, your casework. And we have two types. First, you get the report that there might be a concern for a child in a family. And what you do an initial assessment. And you have 2 weeks to do that initial assessment. And what you do is you invite the family and the child to your office, and you talk to them. I'm going to go through from which points, what you look at in the family. After that initial assessment, you meet them one time, you meet the family one time, you talk to the parents, and you talk to the child. Preferably individually, you talk to the child. And many of us know that you can talk to kids about pretty hard things, difficult things, at an early age, using different instruments. That initial assessment, you answer one question. Should we do an investigation in this family or not? So you have to, in many cases, just say, no, it's not needed. If you need any further help, contact us. And that also helps the schools to report and not to be afraid, and gives the parents and the family a good experience that they listened to us, we came there, they addressed us in a respectful way, and they sent us home, and if we need any help, we can contact them in the future. And or the initial assessment can say that in this family we need to do an investigation. And then they are sent to a caseworker who has 4 months to do casework and investigate the family and the child, the needs of the child. And they look at 3 parts. The parent's capacity, the child's development, and the family and then the environment. And this goes for all problems. This can be a low attendance in school. This can be the kid has a drug abuse of their own. This can be the parents have drug abuse. This could be violence in the home. In Sweden, it's illegal to hit your kids. Even if you're trying to do something good for them, it's illegal. Even if it's illegal in your country, you can still work with it. So you look at different risk factors. You have to have something to hold on to, as a gentleman commented here earlier. Because you look at the family and trying to help, and you want to see, is there a problem in the family or not? You have to know, what does research say is a problem and can lead to problems in the future and not. So this is just an example. I'll skip that. These are different risk factors. We have a program that we follow on which risk factors we look for in the family. These are some. These are also some. These are different aspects that we look in regarding the family and the environment. And the child's development. We don't do this, we do this very personally. It might not look like that, but the most important thing to look at is the relationship with the parents. And to do that, you have to go to yourself, you have to look at your relationship with your parents. You have to see yourself in the family that you're addressing, that you're meeting, that you're working with. Because we talked about stigma, not to make them any different than you. So we don't go through a checkbook and check to see if there's any problem in the family. We get very involved and listen. And the most important thing that we search for is, what is the relationship between the child and the parents? Who are the parents telling the child that the child are? For example, if I go to my own life, I grew up with a very strict father, and when you have a very strict father, you might be told as a kid that you're not good enough, for example. We talk about these with our coworkers. We all have many problems. Maybe we don't have drug addictions, but we all have our own things that we're suffering from. And similarly, they have their problems, and in many cases, the parents might not be aware that they're telling their kids these things. They might want to create a good life for their kids. They might be trying to discipline the kids. And this is where you come in with respect in trying to talk to the parents about different approaches. And this can be true also with older kids, 16, 17-year-olds with drug addictions, that you can try to help the parents in how to deal with it. I already said this. How much time I got? Okay. And intervention, just a few words about intervention. The most common intervention is to go through the parents and trying to help them help their kids. But we also do place in institutions. Foster care is a very, in my opinion, can be successful. Some cases, the parents can even lose custody of the child, and they go into state custody. Thank you so much for your time.
Thank you, Fredrik. Actually, we're working, we're looking at the Swedish model to see how we can create something that is very child-friendly in handling cases here. And Fredrik is actually working behind the scenes to help us create that, which will be the recommendation that we're going to give at the end of this conference to the governor. And we hope that we will be able to make some changes. Though we don't have a social security system, we are hoping that we will learn from nations where you've been able to successfully implement. Dr. Rajesh.
Thanks, Dana, and organizer, for including children into your 3 days program. Thank you very much. Organization I'm representing here, SPYM, which has been working in India for last 35 years. We started as a students of Jawaharlal Nehru University, and some of our friends were drug users. And in last 35 years, we have traveled a lot. Around 10 years back, one of our former Chief Justice of India, Mr. Deepak Mishra, when he was Chief Justice of Delhi High Court, he was attacked by children in a in an observation home. So we were called and we were asked to do something for children. We had no clue. Please remember, we have been working in this sector for last 25 years then, and we had no clue what to do with these children. And when the children came to our center for treatment, we realized that some of had committed heinous crime like murder, robbery, you name anything. So we were very uncomfortable. We started learning over a period of time, and then we decided to do 2 things. Number 1, develop a policy framework for the Government of India and develop model for different states. And I'm very happy to inform you that we have succeeded in both. Now, this year, Government of India has announced that at least 10 centers for children will be established in different parts of the country, mostly large cities. And we have developed standard operating procedures, how to admit, what are do's and don'ts. It took us time. So I'm going to share the most important and difficult challenge was how to establish that children are in trouble, children are using drug. Most of the surveys started only 18 plus, and 18 plus means the children will be never included. So, how to operate this? So I'll skip this because this has already been shared, and please inform me 2 minutes before. This was published last 26 June in one of the India's leading newspaper. And because of this, there was 2 hours discussion in Indian Parliament on 4th of July. So now gradually people have started accepting that there is a problem. This was 2 years back. It was again published in same newspaper. 80% children of a particular area were drug users. Now, this created some problem for the local police, and somehow it was sorted out at the local area. So the second, the earlier paper creeping it was very important for us to push this through few member of parliament that please ensure that there is a discussion. So last July on 4th, that was discussed. The problem is it has not been internalized. Like we have large number of organizations working with children, but whenever they have issue, the children have issue related to drug, they simply say, we can't do anything and just take them to some other treatment center. So we have been working with this. Large number of our child care institutions have children using drug, but somehow they get drug inside children home. So that's a convenient way of handling children, those who are using drug. Now these are the studies. Since I have less time, I would like to spend more time on what we have done. And this is available. I think you are going to circulate this. So these are the studies over a period of time in India were carried out by various agencies. And we ensured that those agencies are credible agencies, those who carry out, for example, the first study was carried out by NCPCR, that's the National Child Right Organization of Government of India, in partnership with All India Institute of Medical Sciences. So both are very credible organizations. And I'm also secretary of a national federation called FINGODAP, Federation of Indian NGOs, which has almost 500 members all over the country. So most of them participated in that. So we try to develop a lot of evidence or gather evidence to prove that there is a problem in this country, especially related to children. This is that study. One important aspect of children using drug, most of them, they start with inhalants. And I don't know about other countries, but in India, inhalants are not considered a dangerous drug or substance. Unfortunately for children, that is the worst drug. Because inhalants are not drug, it's a simple petroleum product, it's a volatile solvent. Again, it took us 3-4 years to convince High Court, convince Supreme Court, convince various stakeholders that please take this as the most serious issue for children. And now, over a period of time, they have realized, in fact, I'm very happy to inform you, because of various stakeholders' advocacy, Juvenile Justice Act was amended in 2015. And they have inserted section 77 and 78 where if anyone is giving drug to any child or using them as a peddler or trafficker, then they will be punished up to 7 years. Unfortunately, what happened, these inhalants were never part of that section 77, 78. So 2 years back, what we did, with the help of our friend like Dr. Professor Atul Ambekar and others, we helped Delhi government to notify this, that this is also considered as a drug for children. But we knew that this will be challenged in High Court of Delhi. And Juvenile Justice Board, which is a children court in India that's called board, they sentenced one person who was selling selling inhalants to children. That decision was challenged in High Court. So last year, High Court of Delhi said, yes, if you are giving inhalants to children, that will be considered as drug under section 77. So now, fortunately, no one has challenged that decision. So for India, giving inhalant to children will be considered a crime. Look at the number, and this number has come from our friend Professor Atul's initiative and hard work. It's a huge number, but nothing is happening, literally nothing is happening. So forum like this, we want to highlight that, look here, if you do not do anything, the children, majority of the children, those who come to our center, have learning disability. Because of the learning disability, what happens, some of their friends will say, just smell this and you will be comfortable. So memory loss, the brain gets damaged, liver, lungs, all this. A child who is growing till 20, 18, 19, if doesn't have brain, doesn't have some good quality kidney or liver, even if the child is out from drug, what this child is going to do in his or her life? That's our challenge. So we have been trying to sensitize, and we are very happy that things have started moving. Okay, this is the history. So what I'll share, that evidence is there now. People have started recognizing this is a problem. We started a drug treatment center for children, those who were in conflict with law. Till now, we have treated almost 3,500 kids, both male and female. And we have 3 centers, and those 3 centers have become now like a demonstration sites. Virtually every month we get a lot of judges, a lot of police officers, a lot of social workers, they come. We orient them, we sensitize them, a lot of police officers come. So we do a lot of training, orientation, hand-holding with help of these 3 centers. These are, in fact, Delhi government is still in denial. Just last week, they said, because I'm a member of a juvenile justice committee, which is a very unique structure in India. All the high courts of Delhi, they have a juvenile justice committee, and since I'm a member of that, so Delhi government said, no, we don't have problem of children. Again, in spite of getting all this information. So judges asked me, can we go to any field, any area where we can see this live? And on 12th of October, 6 judges with Delhi government will be visiting one of the area which we have suggested. So there is a lot of active support and engagement of judiciary, and that has helped us. We always believe early prevention, early intervention, and all the people sitting in the room, they also have the same idea, so I don't want to spend more time. We all are convert. Now, this is a very unique, 2 letters I'm going to show you. This was written by Delhi government because Justice Mishra asked us to start treatment center for children. Initially, we had 10, 15 children. We said, no problem, we will take care. When we had more than 60, 70 children, we said that we can't manage it. If you see the highlighted, SPYM had consented to provide de-addiction services that OHB is a children's jail. In India, it is called observation home. With any financial liability to the government. Now, all the kids, those who are in observation home, they are in custody. And if we are going to treat them, how government organization or government can say that we will not give you a single penny, and touch wood, we have survived without their support till date. Again, the earlier letter, you see, this is 25th January. On 8th February, they are asking us again, please refer to your letter such and such, and you have asked us, and you have to reiterate that you will not ask any money. This letter has no relevance now, but I'm just saying that how government can deny that children are in trouble, children have issues related to substance use, and somehow, we have been working with, thanks to judiciary, thanks to friends like Professor Ambekar, I'm referring him again and again. So we started a treatment program. I told you we have treated more than 3,500 kids. Not a single child has given till date any problem to us. Without resource, treating children, and each child stays in our center around 3 months, 90 days. Large number of these children, those who are now 18 plus, they are gainfully employed. Some of them, if you have opportunity, just go on our, we have developed a YouTube site, SPYM India, You will see some of the children, those who were interviewed by NDTV in 2011, 2012, now they have their family, their children are going to school, and some of the kids committed heinous crime. These are the program what we keep. How much time I have? Only 2 minutes. First treatment center we started for children, those who were in conflict with law. After some time we started another center for children, those who were not in conflict of law, or they were not caught for committing any crime. So this is the second center. The third we started for girls, those who are below 18. And unfortunately, half of them are HIV positive, half of them have a lot of issues, mental health issue. Most of them come with kids. Some of them are, like pregnant and bring 2 children. So this is about that center. These are the services we provide. We get large number of volunteers and interns who come and support us. Over a period of time, we have developed, because most of the life skills modules which are available on web are not good for these children. It took us 5-6 years to develop modules appropriate for these children, and all these modules have been developed by children, only the language has been put by the professionals. So these are the activities we carry on there. This is, the name was also given by them, today and tomorrow, because there is a program and most of you know just for today. So they said, okay, you have told us what has to be done today, but we need something for tomorrow. So these are the materials, and all these materials are available on our YouTube site. What we have done over a period of time, we have digitalized all this material. Of course, unfortunately, that's only in Hindi, but we are trying to also in English and 4 or 5 Indian languages. So most of these materials will be available or are available for NGOs working in India. They don't have to buy anything. It's all free. These are the children, those who are from our treatment center. These are all games, because the children in our center said, we don't want to study. No, otherwise we should have been in school. So most of our program is through sports and games. I'm very happy to inform you, we developed 2 different models also, peer-led intervention and outreach and drop-in center. Last year, Government of India accepted our 2 models, and now they have launched it, and around 200 districts in this current year. In fact, Mr. Sunil Kumar is here, and he is the person in charge of this program, and I think he will share when he is going to chair one of the session. 200 districts, and by end of next 3 years, all the districts in India will have peer-led intervention program, outreach and drop-in centers for children, those who are below 18, or those who are not in a position to be at home or in school. I'll just conclude. This is that peer-led intervention. We also do a lot of training program. Just one slide, which is very important. We do a lot of training for teachers, counselors, and I'll show you the impact. This is of East Delhi Municipal Corporation. In Delhi, we have 3 MCDs, municipal corporations, South, North, and East. East is the worst area from the drug angle. The number of children, those who have been screened, is almost 10% children have accepted that in last 30 days, we have used some drug. And they are all below 10. Municipal corporation schools are only up to primary level, class 5. 78,896 children were screened, and if you add this, it is almost like 10,000 plus. 1,40,524, 50% are girls and 50% are boys. But the figure what you see in second, third, and the third, fourth, and fifth column, this is all for male children. Most of them are male children. So, you know, if the percentage will go up to around 15 to 16%. Since I don't have time, so I can't share a lot of things. Thank you very much.
We're actually running out of time. Intentionally, this panel and the next panel is planned around children and family and their safekeeping. So we have the next panel also dealing with a similar subject. I think we can keep the questions at the end of both the panels. We're just running a little behind time, but we'll take one question if it's okay, because it's such an important subject and we just can't put it under the rug. Which is what we've been doing, at the risk of sounding very controversial here. As much as we talk about policies in place in India, I'm only talking for my country, at the grassroots level, implementation and enforcement of all of this is a big sham. We are very grassroots people. I was just talking to Sumnima. Why we intentionally put Fredrik on this panel is to contrast countries and the social security systems. And for us, it's impossible to even envisage a kind of a social security system that you all have in a country like that. We're very large, and our problems are immense. But that does not keep us in the space of an excuse that we cannot deal with our children and their safety. That should be a priority, and especially when it comes to drugs. We also say that the Article 33 is sandwiched between 32 and 34, which is child labor 32, 33 is drug trafficking, and the third is sex and trafficking. So very conveniently, when we deal with a child with addiction, we are talking about labor, them being used as mules and making money around it, and they are also into the risk of being trafficked or into the sexual abuse problem. So it's a very coupled thing for us when we deal with a child. These issues we can discuss all day when it comes, and we could have an entire conference just working on the safety of the child.